Hi, I'm Dr. Jonathan Sykes. I'm the Director of Facial Plastic Surgery here at my office at the Roxbury Institute in Beverly Hills. I'm going to talk today a little bit about facial sculpting and how we change a little bit face shape by injecting some areas. My patient is a really beautiful woman who is in her mid-40s, and she's had basically some filler in her face before, has had some of that dissolve because she didn't exactly like the way it looked, and we're going to sort of start from scratch now. If Nicole sits up for just a little bit and we sort of hold a mirror here, I look at her cheeks and I like the idea of giving her a little boost by augmenting her cheeks. And like a lot of people, she's got a slightly smaller cheek on one side and this is her slightly larger one. I'm going to put a little bit more filler in this side than on the other side. She also has a really good jawline, but I find that enhancing her jawline from about here to here does a wonderful job of making her jaw look better and making her other features stand out. When I do that and I slightly augment her chin and augment her jawline, it will allow me to put a little bit of filler, and she's got beautiful shaped lips. We'll put a very minimal amount of fillers. I find that a lot of injectors overfill the lips. I never like the lips to look overfilled. The other thing that I'm going to do, and if we look at her from the front, I'm going to augment her brow underneath, which will give her a pseudo lift. It's not a true lift, but it'll make her eye, which is really beautiful if you look out here, look even enhanced by filling out the brow fat pad. And then lastly, she's had a couple of nasal surgeries and has had a little bit of over removal in this area. We're going to augment the bridge of her nose ever so slightly and make her have a little bit of a straighter profile. And it's not that she has a bad looking nose, she has a very pretty nose, but we're going to enhance that. I think of all these things as enhancement and not really making a person look different. It's enhancing what nice features they have. And Nicole has some wonderful features. She's a really beautiful woman, and we'll enhance that beauty that she already has. So we're going to start the injection today by putting a little bit in all the areas. One of the advantages of putting a little bit in all the areas is this material, and I'm going to use Juvederm Voluma. We're going to use Voluma. It has lidocaine in it. And so as I put a little bit of this in each area, she becomes numb. I'm going to do her chin and jawline before I do her lower lip. That will numb her lower lip. I'll do her cheeks before I do her upper lip. That will numb her upper lip. So we're going to start at her right cheek. Do you feel that very much?
Very little.
Because we would like to film this well, I'm going to inject from this side of her and inject just a little bit in the reverse way that I normally do. I'm going to add a little bit to this left side of the chin. So now you can see her jawline being slightly enhanced by just filling that out a little bit, and it really makes a nice thing to enhance the jawline. Now I'm going to lift her cheekbone up just a little bit more, and I'm going to do that on the other side. This is the bigger side, so we need a little less filler on this side. And now I've completed one syringe. Now I'm going to work up on the brow, and we're going to put a tiny amount directly on the brow bone. Now I'm actually going to slip around to that side for just a second and put a little bit on her brow on this side. Now we're just going to enhance all of those areas just a little bit. Not a lot, but a little bit. In any area where you look like you need a little embellishment, we'll enhance that. Okay, not too terrible. A little different, huh?
It was different.
Yeah. I try to inject the medial cheek pad to give a little bit of projection to your medial cheek. We're going to do the same thing over here. If you can see, I've done all of this with now less than 2.5 syringes. I almost try, pressure there on your chin, I almost try to use as few syringes as possible. Okay. Pressure right there, don't let that go. Other hand. Yeah, hold pressure there for just a second more. Pressure there. So we have completed the main sculpting injections. The only thing that remains are the lips and a little bit on the nose. And what I've done is 3 syringes of Voluma that were blended ever so slightly with a little bit of normal saline, and that allowed for equal diffusion. Did you feel any pain during this?
It wasn't painful, just a little prick of the needle in, but once it went in, it was very comfortable.
Yeah. Now I'm going to lastly do your nose and your lips, but very subtly. Sting. Hurt? And then I'm going to put one more here. Very slow injections. Pain?
Nope.
Good, hold pressure there. Okay, now back to finishing off your nose. So we've finished the injection for sort of sculpting and enhancement. If you want to hold the mirror up a little bit, Nicole, you can see that we've augmented your cheeks on both sides. We've augmented your brow a little bit, which has really opened up your eye. If you hold the mirror up a little bit and look at your eyes, they just look stunning. We've augmented your jawline, and that looks really good and balanced. And then I did a very subtle augmentation of your lips, which really look nice. I've turned up the corners of your mouth, and then I made your profile just a little straighter, as you can see. Makes you smile, I can tell. And it makes your nose look a little less operated upon, and it really looks balanced. I mean, you have a pretty nose to start with, so this just enhanced all the features of that. So this is a procedure that the whole thing of it took maybe 25 minutes, 20 to 25 minutes. And we've done 4 total syringes, 3 of Voluma Juvederm into the jawline, into the cheeks, underneath the brow, and a little bit into the chin. And then 1 syringe of Juvederm Ultra into the nose and into the lips. The combination of those 2 things has turned her into a supermodel, which she was probably already almost anyway. So I hope to see you soon.